All right. Today, we're tackling a massive, kind of invisible challenge in medicine. It's this problem that can stop a potential life-saving drug dead in its tracks way before it ever even gets close to a pharmacy shelf.
We hear about these incredible breakthroughs in labs all the time, right? So why is it that so many of these promising new drugs, these potential cures, just end up failing? I mean, the molecule can be perfect, the science totally sound. But when you put it in the human body, nothing. Zilch. So what's the missing piece here?
Well, the answer, and this is pretty surprising, often isn't about the drug itself. It's about how it behaves inside our bodies. It all comes down to clearing this one fundamental hurdle that every single medication, I'm talking everything from aspirin to antibiotics, has to get over. And that one property, it's called solubility. Look, for a drug to work, it has to get from that pill, or whatever form it's in, into our bloodstream. And since our bodies are mostly water, that means step one is it has to dissolve. If a drug can't dissolve, it's pretty much like a key that can't fit into a lock. It doesn't matter how perfectly designed that key is, it's just not going to work. Okay, so here's what we're going to do. We'll start with that first hurdle. Then we'll take a peek inside the lab to see how scientists actually measure this stuff. After that, we'll get into the messy real-world complications. And then, the really cool part, how they solve this whole dissolving dilemma. All right, let's really dig in. Why is this one property so fundamental? This isn't just some boring chemical detail, you guys. It literally dictates whether a drug even has a chance to work. Think of solubility as the ultimate gatekeeper. It directly controls something called bioavailability. That's just the fancy word for how much of a drug actually gets into your system to do its job. So yeah, poor solubility means poor bioavailability. Simple as that. It also decides how a medicine is even made. Can it be a simple pill, or does it have to be a liquid, maybe even an injection? And, at the end of the day, drug companies can't get that all-important approval from regulators like the FDA without proving they've got this completely figured out. Okay, so if it's that important, how in the world do scientists measure it? I mean, how do you put a hard number on something that sounds so basic? Well, for that, we've got to head into the lab. And this quote, it really gets to the heart of the whole scientific method, right? You can't fix what you can't measure. So before you can even think about improving a drug's solubility, you absolutely need a precise, reliable number. So this right here, this is a pretty classic lab setup for measuring solubility. And hey, you don't need to be a chemist to get the idea. The key thing to notice here isn't the specific glassware, but what it's all for. And that's extreme precision. Every single one of these tools is designed to mix, measure, and add liquids with just pinpoint accuracy. We're talking drop by drop. The process itself is this really clever technique called titration. First, you make what's called a saturated solution. Basically, you dissolve as much of the drug into water as it can possibly hold. Then comes the magic part. You add a second chemical, drop by drop, that only reacts with the drug that's actually dissolved. The second an indicator changes color, it's like a little chemical flag going up, bam, you know you've found every last molecule. And by seeing exactly how much of that second chemical you used, you can calculate the drug's solubility with incredible precision. But of course, a clean, perfect lab experiment is one thing. The real world, and especially the inside of the human body, that's way, way more complicated. You see, the core principle here is like dissolves like. It's the exact same reason oil and water just don't mix. Some drugs are what we call hydrophilic, or water-loving, think vitamin C, and they dissolve super easily. But here's the kicker. A lot of the most promising new drugs today are lipophilic, or fat-loving, like ibuprofen. They actively resist dissolving in water, which, yeah, that makes getting them to work inside our mostly water bodies a huge challenge. So because of this huge difference, scientists needed a way to sort drugs based on this exact problem. And that's what led to a system that is absolutely central to how we develop drugs today. It's called the Biopharmaceutics Classification System, or BCS for short. And you can just think of it like a report card for drugs. Class 1 drugs, they're the straight-A students. They dissolve easy, they get absorbed easy. But Class 2, that's where the real challenge is. These are drugs that are great at getting into our system, but only if you can get them to dissolve in the first place. And since so many of today's new molecules fall into this category, cracking the Class 2 problem, well, that's the whole ballgame. Okay, so this is where the real innovation kicks in. How do scientists take one of these promising but stubborn, non-dissolving Class 2 drugs and actually turn it into a medicine that saves lives? Let's look at a really powerful, real-world example, ritonavir. This is a critical drug used to treat HIV. But in its early form, its solubility was just terrible. And this meant patients were getting these inconsistent, dangerously low doses of the medicine. Plain and simple, it was failing.
The solution was just brilliant. Instead of messing with the drug's chemistry, they changed its physical form. They created this thing called an amorphous solid dispersion. Now, just think of it like dissolving the drug into a solid, sugary glass that instantly dissolves when it hits water. And at the same time, they used nanocrystal technology to shrink the drug particles down to a size that's almost impossibly small. And the result? Get this. The new version of ritonavir had 10 times higher bioavailability. 10 times! The exact same drug molecule went from being a total clinical failure to a cornerstone of HIV therapy. And it was all because scientists figured out how to solve the dissolving problem. And look, ritonavir is just one example. Scientists now have a whole toolbox of tricks they can pull from. They can do something called micronization, basically shrinking drug particles to increase their surface area. They can create those solid dispersions we talked about, locking the drug in a carrier. They can form salts, which is a way of chemically tweaking the drug to be more water-friendly. Or they can use nanotechnology to build these tiny little delivery vehicles. It's this constant race to find the perfect solution for each unique drug.
So, what's on the horizon? What's next in making these drugs work better? Well, as the molecules themselves get more and more complex, the solubility challenge, it just gets bigger. And that means the solutions have to get even smarter.
Right now, researchers are exploring some really cutting-edge stuff, like co-crystals. These actually change a drug's physical structure to make it dissolve better, but without changing its chemistry. They're also using things like supercritical fluids, and just picture a substance that's somewhere between a liquid and a gas, to engineer drug particles in completely new ways. The innovation here, it's just relentless.
And all of this leaves us with one last, kind of fascinating thought. Just how many incredible cures, how many life-changing medicines are just sitting on a shelf in a lab somewhere right now, perfect in every single way, except for this one little problem. It makes you wonder, doesn't it? The next great medical breakthrough might not be a new molecule at all. It might just be a new, ingenious way to solve the dissolving dilemma.